Good afternoon. My name is Blake, and I am a second-year medical student and had the pleasure of working with fellow medical students and residents within the Department of Radiology at Oklahoma State Medical Center. Our case report is of a hyperdense middle cerebral artery sign in a setting of acute cerebral ischemia. The non-contrast CT is the initial imaging modality of choice for acute stroke symptoms. This is due to the ability of non-contrast CT to differentiate between hemorrhagic and ischemic stroke. In the setting of acute ischemia, one of the earliest markers on non-contrast CT is the hyperdense middle cerebral artery sign. This hyperdensity is suggestive of occlusion due to thromboemboli within an artery, most commonly the middle cerebral artery. Identification of a hyperdense middle cerebral artery sign is diagnostically advantageous, expediting the patient towards pharmacologic or surgical intervention. Therefore, the recognition of early manifestation of cerebral ischemia on non-contrast CT is imperative for accurate diagnosis and therapeutic guidance. Our case presented from the ER department at Oklahoma State Medical Center, a 40-year-old female with a past medical history of non-ST elevated myocardial infarction, peripheral artery disease, and deep vein thromboembolism, presented to the emergency room with respiratory distress, nausea, and vomiting. Upon arrival, the patient was unable to follow commands, obtunded, and hypoxic. Given the patient's altered mental status, non-contrast CT, CT angiogram, and CT perfusion studies of the head were ordered. Imaging revealed high attenuation of the right middle cerebral artery, signifying arterial occlusion without intracranial hemorrhage. Reevaluating of the patient showed new onset left-sided facial drooping, as well as left upper and lower extremity paralysis. Thrombolytics were not administered due to the patient's onset exceeding the therapeutic window. Thrombectomy was deemed a suitable treatment, and the patient was transferred for urgent intervention. In this study, our patient presented in the ER with a history of chronic vascular disease and new onset neurological symptoms. Subsequent imaging revealed an HMCAS, or high dense middle cerebral artery sign on non-contrast CT, suggestive of acute ischemia, figure 1, seen at the yellow arrow. CT angiogram revealed a filling defect within the right MCA consistent with our non-contrast CT findings, pointing at the red arrow in figure 2. The CT perfusion was obtained to visualize sufficient collateral. The CT perfusion study was obtained to visualize sufficient collateral blood flow in order to delineate injured tissue from salvageable tissue. The area identified in red represents the core infarct, which in the area considered unrecoverable from infarction. The area identified in green is the penumbra, known as the area at risk of infarction that can still be recovered with reperfusion. The difference between these two values, the mismatch, was 72 cc. This measurement indicated thrombectomy was valuable to recover salvageable tissue in this patient. Our conclusion: the presence of the hyperdense middle cerebral arterial sign on non-contrast CT is specific for acute embolism and shows an increased likelihood of poor clinical outcomes with associated acute neurological deterioration. Moreover, additional studies can be useful in reducing disability by identifying salvageable tissue and initiating reperfusion therapy due to the increased morbidity and mortality. It is crucial to be aware of early ischemic signs on non-contrast CT to guide therapeutic intervention in patients with hyperdense middle cerebral artery signs. Thank you for listening. Here are references that we use from looking at these